how wonderful actually to follow Lesley, who has presented, as she rightly said, research with a rigorous approach and properly peer reviewed. I'm not going to talk about research like that. Not too many slides, fortunately. So we now are at the beginning. Apologies for that. And I will try and make sense now. So here we are. The NCT responded to a call last year from two all-party parliamentary groups, the one on maternity and the one on baby loss. Both of those groups, obviously made up of MPs and supported by maternity organisations, were desperately worried about the issue that we all know about, lack of staffing in maternity care. They were called out to all sorts of organisations, including ourselves, for evidence to show how this was impacting women. So the NCT, where I work, was able to carry out a pretty quick survey. Again, my colleague Jennifer Holly, who actually carried it out, was keen to say this is not a rigorous approach. It was carried out via social media, and we knew that wouldn't be demographically representative. But the sort of responses that we got were matched up so much with what we were hearing elsewhere. We're not so worried in this case about full representation, because I don't think many people would argue with the sort of comments and numbers that came back. So it was called, it is about women's experiences in maternity care. It was women who gave birth within 12 months before July last year. So it's 2021 to 2022. And the actual title is a quote from what one of the women very tellingly said: "Too few midwives are carrying too heavy a load." And I imagine that will resonate with a lot of people who are actually in the service and those outside it, but knowing what's going on. We asked questions of women which were partly based on some of the questions that appear in the Care Quality Commission maternity survey, which Lesley talked about just now. They were also designed to identify the red flag events, which are criteria defined by NICE, the National Institute for Health and Care Excellence. And red flag events show where delays or inadequate care happens because the staffing is not up to the level it should be. Now, my first few slides are referring to the maternity journey of women overall, and then we'll move on to postnatal. But these do show that there were a lot of red flag events, far too many than should be happening. They're not necessarily dangerous. It may be a delay that actually doesn't have an impact on the outcome, but some of them certainly will. I wanted to put this in. This is an absolute, obviously, the words from one of the women who responded. And it is a very nice thing to read because in spite now, I beg your pardon, these slides are moving themselves, but to give you a chance to read this, this is a woman who had some troubles in what was happening during her birth, but she absolutely appreciated the way that the midwives were cheerful and caring and kind, and I love it, upbeat and perky. I know a lot of midwives can't say they feel that, but obviously for this lady, fantastic. She got that impression. But she knew they had a lot to do. They were on the clock. They were experiencing long and unsociable hours of work. And that obviously came over in spite of the fact that she describes her care as amazing. And we did hear this sort of comment quite often. So we asked about personalised care. And around 65, just over 65% of women did feel listened to nearly all the time. So around 2/3, that's good. But unfortunately, that's a third or more than a third who did not feel listened to. And that is something we don't want to see. We go on to ask about women having the right amount of time and information and support to make a decision. Decision making is very important. Perhaps it might be said more important in intrapartum care or late pregnancy, but apologise for this moving back and forth. I think the slides are moving before I'm clicking, but let's try and keep to it. So around half women did not have all the time and support they needed for decision making, quite worrying. Now, delays in care, unfortunately, this is even worse. Only 44% of women said they were always able to have the care they needed in a timely fashion. And the delays were most common after giving birth. No great surprise because of all the things we've heard. Now we move on to the more detailed description of postnatal care, and unfortunately these are the words that were used quite, unsolicited by women: carnage and hell and total chaos. That was how women felt when they were in the postnatal ward, and described their own feelings as unsupported, abandoned and unsafe, which is a desperately worrying thing. We know that women are very vulnerable at that time. Their babies are vulnerable. They worry about the babies, and some of them it is the beginning of really poor mental health because the anxiety is so damaging shortly after, often quite a worrying birth. And this is clearly something that needs to be addressed. This is again a long description. A woman who described being very aware of the lack of midwifery resource. Again, these things are clicking on without my doing so. I do apologise, and I hope that's not spoiling the way you're absorbing what I'm saying. It's very sad here that she described staff in tears due to the pressure they were working under. Again, she's expressing her own sympathy. She knows that's not the fault of any individual member of staff. But the result is, as in her last few words, I didn't feel my baby and I were safe. And again, this is, as you'll all feel, I think, very heartbreaking to read. It's an awful environment for the midwives and the support workers, and it's an awful environment for the mothers and their babies. And many of them said they just wanted to get out. But of course, discharge was quite often delayed as well. At the end of the report, which has been written up around this survey that we did, and I'm sorry to say there have been delays in actually publishing this, and of course it is, it would be that it's actually going to come out next week, and I'm hoping we may be able to add the reference to the list of references that Sue will be putting together by the end of the week. But in any case, it will be out there. So we had 8 recommendations at the end of our report altogether. Some of them are what you might say is the very obvious ones, but you can't leave them out. They resonate with a lot of recent reports, such as the Ockenden report on Shrewsbury and Telford, the Kirkup report on East Kent, and so on. Investing in the workforce, listening to women, promoting relationship-based care, better multidisciplinary teamwork. Number 7, we have put in enabling partners' presence at in-hospital postnatal care. I know that this is improving as time goes on, but certainly last summer and the months before that, women were still having that damaging impact from the lockdown era restrictions, where they found their partner was only able to come in some cases for an hour a day. I think one woman found she wasn't able for him to come in at all in the postnatal ward. And that was absolutely impacting because this particular individual woman, the effect of her epidural lasted quite a long time, so she couldn't walk at all. She was not able to get help to get to the bathroom. She couldn't reach any food and water, and she couldn't reach her baby. And nobody came when she asked for help. And that, again, was an absolutely catastrophic experience for her. What I want to go and talk about, and it's a little bit more positive, I hope, we put in as our last recommendation on postnatal care, we want to bring together a coalition of policymakers, service users and professionals on postnatal care. And we want to call for a complete end-to-end review of this period of care. Ideally from birth to more than 6 weeks, because I think many, many women need more care. And we know, looking at the results, for example, from the Embrace report, which looks at the very tragic deaths that happen up to a year after birth, and some of those are pretty much relatable back to what happened at birth or in the early weeks. So we think probably should be longer. But we would like to see a national level review, which could look at the whole area. Often, and here I've put the problems, particularly postnatal mortality, are due to mothers falling through the gaps between those threadbare services. And you will know them. It moves with the woman from the acute care area in a hospital to community midwifery, sometimes from a different trust if the woman has given birth out of her immediate area. The midwives visit as much as they can, but sometimes only one home visit in the first few days, and the care swiftly passes on to health visitors who are employed and commissioned by local authorities. And in many cases, we've heard of health visitors having a caseload of over 700 families, and that pretty clearly means for the next few weeks, many women and their babies are not receiving a visit at all. They may be told to go to a surgery or a hub or a clinic somewhere, but especially if they've had a difficult birth, a cesarean birth, where they're told not to drive, etc., they won't be able to get there, and they're getting pretty much nothing. We know that most women now are getting a check from their GP, but it isn't always what they expect. Some GPs have not been trained and refreshed in this area, so they're not absolutely up to date. We know that's not anyone's fault. GPs have had a extremely pressured time over the last few years, and it's not possible for all of them to have carried out the right training. But it does show that postnatal care at the moment is sometimes provided by 4 different institutions. Information doesn't always pass from one to the other. All those professions are overstretched and understaffed, and it means that women are falling through the gaps between them. So one thing we are going to do is respond to the Health and Social Care Committee in Parliament is launching an inquiry into prevention in health and social care. Now, to my mind, and I hope that is in agreement with the MPs on this committee, getting postnatal care improved would be an immense step forward in preventative health care. The number of things that can happen to the physical and mental well-being of both the mother and the baby that result from poor care in the postnatal period is enormous. It may be simply the information that they need in terms of follow-up from some complication of pregnancy or birth, women who've suffered from hypertension, from gestational diabetes, from cardiac problems. They need support, they need follow-up, and they need information for their lifestyle advice, to know whether they need to take certain actions, whether they need to be taking medication, and so on. Lots of things in that area. We know that women suffer pelvic health problems after a birth. There is more help in the NHS for this, but again, it's not very well coordinated, and some women miss out on that and have really distressing problems of incontinence that go right on through the rest of their lives. Babies suffer from things that are not picked up when the health visitors are not there to spot their physical and emotional and mental development, things that should be picked up straight away in that postnatal period and onwards from there. You can see from this slide, I've got a week to do this, and I'm trying to pull together some support and ideas from other organisations and other individuals to try and get this over. Of course, there'll be many other people trying to get their views into this major inquiry. If we have anything to do with it, we will make sure that we're on that shortlist at least. But I hope it will at least make people think postnatal care is not just about midwives, it's not just about hospitals. There's a huge amount that needs doing across all those areas of healthcare, and this could be one way to get the powers that be to think about it. So I'm going to stop now. Thank you very much for listening to me. That's where you can find me if you want to read my tweets about postnatal care and many other things. And thank you very much for asking me.